to our channel Future Your Future. We are going to discuss regarding medical equipments. So earlier I posted one photo in the Instagram story. So what is that machine used in the operation theater? Okay. So commonly we'll discuss some of the equipments. What is a medical equipment and its classification? What is a medical device? Medical device is a device for specifically for any medical purpose. Yes, classification based on the European Union, it is classified mainly as STP classification. So it is site of application will be there, then time scale of use and power source. Again, the STP classification is classified into S1, S2, S3. S1 does not touch the surface, S2 is applied to the surface, S3 is enters the body, and time scale and power source, whether electricity is needed or not. So various examples are encircling this simultaneously on the right side of your PPT. So next is very important topic is cardiac monitor. So you will be able to see the what is cardiac monitor. You can see certain parameters which is there in the cardiac monitor. Heart rate, there is saturation, there is arterial BP and CVP will be there, and will be simultaneously the temperature. This is a defibrillator, mainly for the purpose of giving shock to the patient, and patient is having certain arrhythmias which is shock-coupled rhythms. You will be learning in the ACLS algorithm when we want to give shock. What are the shock-coupled rhythm? Shock-coupled rhythm is pulseless VT, and in this picture you will be able to see the infusion pump and syringe pump for the medication administrations. What is this machine? You will be able to see what is ACT monitor. ACT is mainly will be doing in the coronary care unit and angioplasty rooms cath lab, where you will see the activated clotting time. In normal it is less than 180 milliseconds. So what is this? You will be able to see some machine and its cable, and one is implantable. So this is a temporary pacemaker and its connection cable, and this is a implantable cardiac devices. So everyone know this machine. This is an ABG machine. So every ICU have this machine. So here you will be able to do the blood gas analysis of the patient. Through a blood gas analysis, you will be able to identify the pH, PCO2, PaO2, and HCO3 will be identified. Everyone knows this machine. It's a ventilator. Here this patient is getting the artificial ventilation when patient is unable to maintain the normal respiratory pattern. The controlled mode, assisted modes, and spontaneous breathing modes to make the patient's respiration more easier. This is a portable imaging machine, X-ray machine, where you will be able to take the bedside X-ray of the patient. This is a coronary angiography room, especially it is called as cardiac cath lab, where you will be able to see these type of machines. Have you seen this machine before? This is called IVUS, intravenous ultrasound, where it is using in a cardiac cath lab. Machine helps to assess the blood vessels from within the inside itself. So it uses sound waves to check for the narrowing, blockage, and that can compromise the blood flow. You'll be able to see the fluoroscopic diagram of the vessel. It is called as intravascular echocardiography too. It assesses the severity of the plaque that build up inside the arteries, mainly the atherosclerosis and potential blockages. You will be able to see the video visuals of the how this IVUS is working. So you will be able to see the diameter of the blood vessel as well as the how it is stenosed. You also assess the pre-stent workflow as well as the post-stent workflow of the artery. If you place the stent and how it is working and the placement is correct or not, it also can be assessed by using a IVUS machine. So what is this machine? So this is called an ECMO machine. It is called extracorporeal membrane oxygenation, when the patient requires providing a prolonged cardiac and respiratory support to the people whose heart and lungs are unable to provide adequate amount of oxygen. The answer for the story, Instagram story, is this is bispectral index monitor. So here you will assess the depth of anesthesia. So maintaining these values within the ranges of 40 to 60 is essential to prevent the anesthesia awareness. and mitigate potential long-term psychological complications to the patients. So it is just simply applying the electrodes over the forehead of the patient, so you will be able to get the information through a monitor. Thank you all, and we have explored some of the essential medical equipment that plays a critical role in patient care and clinical decision making. If you found this session helpful and want more such content, tips and academic support, follow my Instagram page, Suture Your Future. Thank you.